afternoon, everybody. I hope you had a good, safe weekend. It's a little lonely up here today, as you maybe notice. Josh and Paul are both available, via Zoom. The reason for that, I think, is just we want to err on the side of caution again. We saw it was a pretty a weekend where the President and Mrs. Trump found to be infected, Hope Hicks, Cam Newton, and figure this is a good time to err on the side of caution. We've also decided everybody in the governor's office is going to be testing on a regular basis, I think twice a week, just as we get through at least, this year and what could be a testy flu season. That said, let me give you some idea of where we are in COVID over the last 3 days, the change since Friday. Interesting. I mean, a lot of COVID cases, 823, out of a lot of tests, 50,000 plus, so we're averaging over 100,000 tests a week, which is a good thing. The positivity rate, though, 1.64. That's not a good thing. It's been more or less flat, 1.6 over the last 7-day moving average, but to be blunt, that's up from 0.8% about a month and a half ago. And while it's only 0.8%, it's something we watch, although it's been pretty flat for the last week or so. Currently hospitalized, I think 19 is a fair amount. Josh reminds me that one half of those hospitalizations took place in New London County. If New London County represents, 10% of our population, it represented half the hospitalizations. It just reminds you how lumpy and this COVID infection could be, and the positivity rate went up about a month ago, and you see that reflected a little bit in hospitalizations as well. 4 fatalities. Again, if you think about southeast Connecticut, I want to give you some relative good news. The southeast Connecticut's got about a 3% infection rate, almost double what it is statewide. It's worth remembering that Norwich, which is we thought was an area of great risk. We really brought in the cavalry there, the rapid response team. It's gone from 7% to 3.5% to 2%. So we'd like to think with fast action we can make some progress, just like we did in Danbury, although it took a little longer to get down in Danbury. I want to give you just a little perspective on where we stand. I appreciate this. There's some states like South Dakota, Wisconsin, Idaho, Iowa, that are in, 15 to 24%, much higher, and they all spiked up in the last few weeks. The lowest states in the country continue to be, or are again, at least in the Northeast, Connecticut, New Hampshire, New York, Massachusetts, Vermont, Maine. That said, we've gone up a little bit in that list, although we're still, near the bottom. The numbers are interesting. Remember New York and Massachusetts. That looks, pretty good, 1.31%. But, of course, New York is much higher in parts of Brooklyn and Queens. It's much less in the Adirondacks. Massachusetts is much higher in Boston, less in the Berkshires. So you have to take these statewide averages with a little bit of perspective, but it just tells you, compared to the national average, which is 4.6%, the Northeast and Connecticut are still doing pretty well, but worth a watch as you look at these trend lines. So as you know, October 8th, coming up this Thursday, we're planning our next phase of reopening. It's sort of a follow-on phase 3 to what we did with the schools going back a month or so ago. So we just asked the team, what do we look like compared to our peers here? You can see when it comes to number of cases per 100,000, we're about like our peers. Massachusetts, Rhode Island, a little bit more. New York, because of the Adirondacks, and Northern New York, a little bit less. Still in relatively good shape. The phases, everybody has different definitions of phases. I'll jump over that one. Restaurants, I think, is sort of interesting. We're going to move from 50% capacity to 75%. 6 feet of distancing between tables, plexiglass otherwise, so that you can do what you need there. People may say, well, you sure, 1.6%? What do you think about indoor dining? Look, I'll face it. Being outdoors for the last few months has been a big plus for our state and a big plus for our region. And I think as you move from an outdoor culture to an indoor culture, that's going to be the variable that we've got to watch like a hawk. It's going from outdoor dining slowly to indoor dining. How many people want to take advantage of that? That's much more important, I think, than the 50 or 75%. We just wanted to give our restaurants a little bit of flexibility. They've been managing so very well when it comes to the protocols, and we're going to stick to that plan. The bars are pretty much closed, as I think you can see. New Jersey opened, surprised me. Rhode Island opened with a meal, I'd say quotation marks, and up to a certain hour. Indoor private events was a change, but you may say 100. We're a little bit more than Massachusetts and Rhode Island. Remember, for our indoor private events at a home, we're keeping that at 25, just because that's less likely to, it's much more erratic, let's say, in terms of compliance with all the protocols that we want to do. Indoor private events at an event venue with a caterer, we know who's going to those events as needed. There we've upped that to 100. We think the event planners, just like the restaurants, are going to be much more careful about making sure the protocols are followed because they want to be able to keep their event venue open. And that's why we've opened up there from 25 to 100 for those event venues. Movie theaters, indoor performing arts, I think we're opening them up to 50%. Movie theaters have been open, as you know. Everybody says, reopen Connecticut. It's worth reminding people that the movie theaters have been open. And I'm afraid that there's just some places that people don't feel totally comfortable going back to, and movie theaters may take a little bit of time. I was reading in the paper, interesting, that the new James Bond movie, No Time to Die, ironic, they're going to pull that back and not introduce it now because movie theater attendance is so low. And Regal Theaters, which is, I think, the second biggest chain in the country, just said they're not going to open. They're closing for good. So there may be a real sea change in terms of movie going. And it's just a reminder that performing arts, theaters and the such is going to take some time to move back. It's not necessarily our restrictions, but it's consumer confidence. My last chart, not to bore you with too many statistics, but first phase of our reopening in this cycle was schools. And I just wanted to get you a little perspective here compared to our peers. Connecticut is much more likely to be open fully in person, more in the elementary schools than the high schools. And I think you see when it comes to fully remote, which is no in-classroom learning, Massachusetts and New Jersey are much more likely to be fully remote. And hybrid is still the method of choice. A little caveat there, just if you look at the dates down below, you can see that not everybody's as transparent as others about what schools are doing. Some of it is based upon intentions, like Massachusetts. We're pretty current as of just 5 days ago. And, the hybrid is, a mix because you have a cohort that you go to school with and you have other cohorts when you're not in school. A little more risk there, perhaps a little more like football, which has been not in a bubble. Like basketball, which I'm a sports fan. I was sort of interested in the basketball, which I think of as a more high-risk sport. You're not covered in padding. You're running up close. But there they've been in the bubble. And it looks like the basketball season will be completed this week. It's more like fully in person, where you stay with your cohort and don't mix with other cohorts, over the course of the season. And baseball, I see, for the finals of, pre-World Series and then World Series is going to be in that cohort bubble as well, just because it's a safer way to go. With that, I'm happy to take some questions. And again, Paul and Josh are right here to bail me out.
Channel 3 Eyewitness News.
Yes, Governor, are you considering rolling back elements of Phase 3 in light of the upticks that we're seeing in cases? Because we've seen, New York go that route in some cases.
New York is a very big state. When it comes to restaurants and the such, I'm still thinking in terms of the state. I'm still thinking that 1.6 is one of, the lowest infection rates in the country. But as I've said on many occasions, if we see a big change, we're not afraid to change strategies.
And is there a positivity rate that we need to be watching out for that could impact phase 3?
As I think about it, there's no absolute number, but I see the rapidity of how fast it changes. And if you get to 4 or 5%, you got to reconsider what's going on if that happens quickly.
And just out of curiosity, in light of what's been going on with President Trump, prior to your announcement that testing will be done in your office 2 times a week, how often were you getting tested? Because you've been out there throughout the state, very visible.
Yeah, I've been getting tested every 2 to 3 weeks for some months now.
NBC Connecticut.
Hi, Governor. Matt Austin with NBC Connecticut. Just following up on President Trump, we are expecting him to leave the hospital this afternoon, and he did tweet out within the last hour or so that, part of it was don't be afraid of COVID. Don't let it dominate your life. Did you see that tweet, and what was your reaction, I guess, to everything that's happening right now in Washington with the president?
Yeah, Max mentioned that tweet to me. I think it's totally inappropriate. This is the exact wrong time to relax your guard. I wish the president was not making light, especially given the fact that he at his age was afflicted. Thank God it was not more serious, and I wish him all the very best when he comes out. But for a lot of people my age, his age, and older, it's been very serious. So this is no time for us to relax.
I know you're talking a little bit about southeastern Connecticut with Norwich. We've seen upticks there and also in Waterbury. Has there been any thought about basically rolling back some of the restrictions in those areas that are seeing upticks?
Well, obviously not rolling back restrictions, but keeping those restrictions in place. I mean, Norwich, I'm told, is going to go distance remote learning for a while, until the infection rate stays lower for a weekly average. And I think that probably makes sense. Danbury did the same thing by not even opening on time because they wanted to wait and err on the side of caution. Thanks, Matt.
News 8.
Good afternoon. Governor, can you give us an idea what it's like in between, say, in this case, phase 2 and phase 3? How much maybe things have gone back and forth, even if in your own mind, in terms of reopening this, not reopening that, the percentage of people? Does it shift almost day to day?
Well, our planning and our reopening strategy certainly does not shift day to day. We started on this path back on May 20th, and here we are now in early October. I look around other states. I get informed by that. It's in part why I shared some of the graphs we have today. I think about restaurants. I see they have not been the accelerant that we think bars have been, for example, as we look around the state, especially in and around college towns. So I'm trying to, we got to stay flexible. If things change, we're going to be able to change, like I mentioned, Norwich and Danbury, but also try and give people a sense of what they can plan for going forward. We always knew October, November were going to be, dicier months given the change of weather, given flu season and the such. So we'd be ready to make a change, but right now we're sticking to our plan.
With respect to moving up the amount of times that you and coworkers will be tested now to up to 2 times a week, was that something that others came to you about, especially after the president said, can we do this, or is that something that's pretty much, right away that clicked in your mind that we need to do this more often?
Look, it certainly clicked in my mind. I mean, nobody has been in, he tests an awful lot, the president. He claims to be a germaphobe. I think everybody around him tested. Let's say they were a little casual in some of the Rose Garden events and some of those big, rallies. I appreciate that, but they just realized that how much risk there is. So I think for our entire team, we thought together as a group that made an awful lot of sense for us to keep a little more distance and for us to test more regularly, and that's what we're going to do.
Fox 61.
Hi, Governor. Dave Puglisi with Fox 61. Quick question about if there is a worst-case scenario in which you do have to delay Thursday's reopening, is there a chance of a financial contingency plan to assist Connecticut small businesses, such as bars, that have still not been able to fully reopen?
Well, the best financial contingency plan we can offer is what we've already announced a week or two ago called shared work, where rather than lay off people, keep them on even if it's on a part-time basis, and we will provide unemployment support for them for the rest of the time. In addition, we've got some small business loans that Commissioner David Lamont will be announcing in the next day or so as well. We've obviously got our non-eviction and rent relief plan that we rolled out over the last few days. And I'm still really hopeful that the U.S. Senate and the House of Representatives will get their act together and come up with some sort of a compromise that allows every state in the country to make plans, at least for the next 6 months of this fiscal year.
News 12 Connecticut.
Hi, Governor. Can you give us some more details about these tests that your staff is going to get? Are we talking the rapid test that the White House was depending on, maybe a bit naively, or are we talking full PCR test? And how long will those results take to come back?
You want to try that, Josh?
Sure. It'll be the standard PCR test. The rapid antigen-based tests are not recommended for asymptomatic screening purposes at this point in time. So we'll be using standard PCR-based tests.
And who all is going to get tested? Are we just talking about the people in the inner circle like you guys, or how far out is that net going to be cast?
It's just going to be Governor's senior staff, people in regular contact with him, his state police detail, his family.
And let me add one point as well. We've been taking great precautions to keep not only the governor safe, the First Lady, Lieutenant Governor, but also our staff as the various protocols. This was a good opportunity for us to enhance those protocols, understanding we're going into the fall months and the recent developments that have occurred not only locally but nationally as well.
All right, thanks, guys.
WTIC 1080 News. The Associated Press.
Thanks, Max. Good afternoon, everyone. Governor, I was wondering, have you been able to determine if the cases in Norwich, have they spread throughout the region at all? Because there have been reports of cases at L&M Hospital in New London, and of course we had the nursing home in Colchester. Or have you noticed that it's been pretty much this one outbreak, if you want to call it, is limited to Norwich?
No, Sue. I mean, I think we've determined so far that the outbreak at the nursing home did result in some community spread, did result in some additional infections in Bacchus Hospital, and did result in at least one person interconnecting with the Colchester nursing home, which resulted in many infections there as well. So it reminds you, it's like a California wildfire. It can move pretty fast.
How did it go with the testing over the weekend, and do you have plans to try to ramp it up? I know there's talk of having a big testing site at Dodd Stadium.
Well, they did a lot of testing in Norwich, if that's what you're talking about. Max pointed out to me that at in and around Bacchus Hospital there were lines of people waiting to get tested. If people were ever a little casual about testing, casual about mass, no longer, certainly not in that part of the state, not anywhere across Connecticut, I really hope. I can't tell you about Dodd Center or other places.
Yeah, I could just add, our rapid response team swung into action last week, and I'd really like to, tip our collective hats to the group involved. Certainly our local elected officials down there, local health departments, faith-based community, and then all of our testing partners. So Yale New Haven Health, Hartford Health, the federally qualified health centers in that area, Semaphore. We performed over 3,000 tests in southeast Connecticut last weekend, not just in Norwich, but also in London, Groton, some other sites down there. So a real strong surge of testing over the weekend. So far, the test results that have been returned are about 3.3% positive. So as the governor alluded to earlier, about half of what we were seeing last week. But again, as you test a lot more, you would expect to see that positivity rate go down. That's the dynamic we hope to see, and we'll keep at it until we're comfortable that we have nipped this in the bud. Still a ways to go before we think we're out of the woods yet in southeastern Connecticut.
When you say southeastern Connecticut, are you counting New London County or? Okay.
Correct.
And I was curious, too, where do things stand in terms of distribution of a vaccine if and when we get one? There was talk on a public forum today with the legislature about trying to prioritize nursing home residents for any vaccine that may be coming out.
Well, I'll start. I can tell you that Deirdre and Reg, who are co-chairing our vaccination committee task force, are going to announce the group there, I think, later this week and probably have their first meeting. So we'll be rolling out the priorities in terms of who gets the vaccine, within a few weeks thereafter. Is that about right, Josh?
That's correct.
Great. Thanks a lot.
Connecticut Public Media. WTIC 1080 News.
Hi, sorry about fumbling the button here. Wanted to ask, is there you have, sorry, I just got nervous for some reason because my microphone thing. Things don't look great. You have 1.6%. It could get a lot worse, but you're saying phase 3 is on. What do you say to people who see maybe a contradiction there a little bit?
That 1.6% is still one of the lowest in the country, that we don't see restaurants as a big accelerant in terms of the contagion, looking around the rest of the country. We think that, churches, we can keep the social distance there, and we can change course if we saw the metrics required it.
Indra said probably in March or April that shutting down after opening up would be the worst case scenario. Does that still stand for the group?
Not for me. I got to tell you, back when we opened May 20th, I thought it'd be a body blow to our confidence if we opened everything too early and then you had to have a U-turn and come back. I think we found that we can reopen safely. We got 95% of our economy open now. Now we're going to 99% of our economy. So if we have to make some fine-tuning, if circumstances change, I think we can handle that, and I think our economy will keep going forward.
Thank you.
The Connecticut Mirror.
Okay, am I unmuted now? Yeah. Governor, you mentioned 3% positivity rate in southeast Connecticut. Can you be a little more specific? What are you talking about? Are you talking about New London County? Are you talking about certain zip codes?
You want to go there?
As a result of testing sites we sampled this weekend, which were almost all in New London County. That's correct.
Governor Cuomo, at his briefing today, did two numbers. He did a statewide positivity rate, and then they put out positivity rates for hotspots identified by zip code. How do you guys monitor that data when it comes in? Is it by zip? Is it by municipality? And is there any thought to doing something similar to having that kind of breakout on, what are the top 5 or so highest positivity rates?
Yes. In fact, we look at it by town. In many cases in Connecticut, of course, their zip code and town is one and the same. But at least from a town perspective, we actually publish that data daily on the open data portal. So anyone who would like to see that positivity rate, both number of tests and tests that are positive, that data is actually published every day.
Is that sortable, though, by rate?
I believe it is. Worst comes to worst, you could export it and sort it yourself. But I think it's sortable on the website, too.
All right. Okay, thank you.
The Hartford Current.
everyone. This is Emily Brindley from The Current. Governor, I wanted to go back to what you just said now about not seeing restaurants as a big vector of spread. There was a CDC study a couple weeks ago that basically said the opposite. So can you explain where you're getting that information that restaurants aren't a vector for COVID spread?
I think certainly compared to bars, restaurants have managed themselves pretty well. We've had them open since May 20th and June 20th for indoor dining. I think our restaurants here in Connecticut have managed that very professionally. They know the worst thing in the world for their restaurant and their industry would be if there was some sort of a flare-up that was identified by a restaurant like that. I know from other governors and even those from some of the infected states, they feel like restaurants were not the accelerant, for example, that bars were. I have read some of the studies that they show some positivity related to the restaurants, but I think so far here in Connecticut we've managed it pretty well.
So let me ask you, since indoor dining has reopened, have you personally eaten indoors at a restaurant?
I have, yep, once, next to a really big window.
And would you feel comfortable personally eating indoors at a restaurant as we move into phase 3 and the indoor capacity expands?
If I can be outside, I'm going to be outside as long as I can.
Can you clarify there, would you feel comfortable eating indoors at a restaurant as the capacity expands in phase 3?
Look, I'll get there. I think so. Like I said, I've been pretty impressed with the restaurateurs. I've seen how careful they are. I see how careful they are about distancing. I'll probably look in. I'd like to see if I see some of those plastic partitions. That would give me a little bit of confidence. Let's face it, it's not like movie theaters. I think people are moving inside. I think they're going, a lot of them would prefer to be outside as long as they can, but it's been, 4 or 5 months now. I think people would be comfortable getting inside.
Thank you.
CT News Junkie.
Thanks, Matt. Governor, where do we stand with the whole contact tracing process? I know that they've rolled these things out and then they've already paid. Do we have an estimated date on when we're going to have calls available?
Your audio is cutting in and out. I'm going to go to another reporter. If you can modify that, we'll come right back to you.
All right.
Hearst, Connecticut Media.
Thanks, Max. Hi, Governor. Would you like to comment on the president's reported infection and hospitalization turning into a campaign event yesterday with his little victory lap and his armored vehicle around the hospital?
Well, just don't take this lightly. I think we want our leaders. I try and take this seriously and lead by example with some failings. I'd like to think that the president, those around them, can do the same thing. Put the politics aside. I think the politics will take care of itself. I'm glad that he, when he said he was infected and had the test, he said it. I'm glad he went to the hospital if his doctors thought he had to go to the hospital. And I don't want him to leave prematurely for political reasons. I want the president to stay safe.
And on another subject, Governor, Mark Ojakian, I sent a letter today. He thinks that the state university system needs about $69 million. Have you talked to him about that? And what's your initial thoughts about that?
Well, I haven't talked to him about that particular letter, but I know that our state universities, UConn, as well as the CSU system, as well as an awful lot of other entities in the state have come to us looking for more support. It's worth remembering that the money we got from the federal government, the CARES Act, the COVID relief money, is specific to COVID-related expenses. So it's not like I can just hand out that federal money for broader purposes like backing up our universities. That said, we have one of the great university systems in the country, so I'm going to do what I can to provide what support I can.
Thanks, Governor. Thanks, Max.
The Day of New London.
Hi, this is either for the governor or Paul or Josh. In areas like Norwich and Danbury where hotspots have emerged, has contact tracing helped to figure out the source of these outbreaks, or how helpful has contact tracing been in tracking down the source of infections?
Yeah, it's certainly been helpful. It's an important tool in the toolkit for our public health departments, both at the local level and at the state level, and they work, and we work very hard at that and invest a lot of resources in it. But as the events in Washington have demonstrated very clearly over the last week, the most important thing is the prevention, right? Getting out in front of it, wearing masks, following the rules, social distancing, and preventing the infections in the first place. I think it's a good reminder from what we've seen in Washington over the last week.
And then also, can you confirm, I just want to make sure I was clear, that of all the people hospitalized right now in the state from COVID, half of them are hospitalized in New London County?
No, what the governor mentioned was half of the growth in hospitalizations in the hospital census since last Friday was in New London County.
Got it. Thank you.
CT News Junkie. The Waterbury Republican American.
Thanks, Matt. I'd just like to clarify something real quick in terms of this testing. When I spoke to the Lieutenant Governor's office last week, actually Friday, Governor, when you mentioned that there would be stepped-up testing, they said that they were going to be included too. So where do they stand?
Yeah, I'll jump in. Yes, members of the Lieutenant Governor's staff who are in close proximity with the Lieutenant Governor on a day-to-day basis, including her security detail, will be a part of this testing protocol that we'll be implementing this week.
Okay. In Waterbury, there's been an uptick in infections. The police chief and the top mayoral aide have been infected. The mayor is testing himself now in quarantine. Since August, the case rate per 100,000 crossed the 2,000 mark. Now it's up 17.7% since then, 12.4% since the beginning of September. Are you guys watching the situation in Waterbury? Is this a potential hot spot on the state's radar?
We are watching it carefully. I think it's a little early to call it a hot spot, but I would like to take the opportunity to thank Mayor O'Leary for modeling the behavior that we hope for and expect of anyone who thinks they may have been in close contact with someone who tested positive. Again, this is another failure we're seeing in Washington, where people who have had close contact are not quarantining for the recommended 14 days to help prevent the spread and protect others that they work with or live with. And so we appreciate Mayor O'Leary, as always, setting the right example.
And Josh, in what ways are you monitoring the situation in Waterbury?
We're watching the metrics every day. We're in constant contact, EPH, with the local health departments there. So we have constant dialogue going with all of our local health partners.
Okay. So and Governor, if this vaccination study committee is going to be meeting this week, exactly when? I mean, it's Monday. They're going to come out with an announcement of the members and then meet this week. So why not just tell us the day?
I think the day's Thursday. More importantly, you're not going to see a vaccine for the near term. What we wanted to do is by October 16th, I think it is, get down to the CDC and the White House our thoughts about how the vaccine should be distributed, what are the priority populations, how we think it'll be the most effective. And that's what they've asked us to do, and that's what we'll do on time.
Okay. And I'd just like to clarify one thing on the deck that you guys put out today. It said Connecticut's positivity rate's 1.6%, and that's a 7-day rolling average. I've been looking up on stuff online, and what I see is 1.1%. So.
Yeah, if you go back to last week, we had some catch-up data from some of the university test results that dated back beyond the prior week. Some of the national websites have not properly normalized for that, which is what you're seeing.
Okay, thank you very much.
CT News Junkie.
Thanks, Max. Can you hear me now?
Yes.
Okay, awesome. Sorry about that. Governor, what is the status? How are we looking with the rollout of the contact tracing app you guys were talking about a couple weeks ago? I know that they've rolled those things out in a number of other states. Do we have a date? Do we think ours will be up and running?
I think probably by the end of this month. I know that our team has been in contact with both New York and New Jersey because we're doing this alongside of them, as well as with the app people themselves. And we'll learn by example from some of the other states. I think it's just one more tool. Look, I got to tell you, the results around the country are conditioned upon people wanting to opt in and use it. If you don't opt in and use the app, it's not very effective. In some states, it's been more effective than others.
Yeah, I imagine one of the concerns there is privacy. Do you have any plan to address people's sort of concern that they're giving up their privacy by opting in?
Well, I can start. I mean, I urge you to opt in. I think it makes you safer. It makes those around you safer, but that's at your option. And secondly, any data about your positivity is totally anonymized, meaning it's anonymous. Those names do not go anywhere, and I think that's very important. There's no database on any of this that can be used.
Okay, and what's the turnaround time on the type of test you guys are going to be using every 2 weeks on you and your staff?
I think it's 24 hours.
Okay.
Yeah, it's 24 hours or less, which is about the same as the vast majority of the testing going on in the state right now.
Awesome. All right, thanks again. Sorry about the audio issue earlier.
All right, that's the signal. I just wanted to share with you this picture. There's an old phrase, you've got to stop and smell the roses, especially during a particularly hectic time. And that has different meanings in different contexts. Our universities have done an extraordinary job of tamping down the virus and limiting its spread. Sacred Heart's been hit a little bit. I think there the president's done an amazing job. Some of the students who weren't following the protocols have been asked to leave. Those that have done a very good job are getting gift certificates. You can have a PCR test. And another way early detection is scent. If you lose your sense of smell, that may be an indication of an infection. So when it comes to stopping and smelling the roses, Sacred Heart has put up these scent tents around the campus as you go into different classes. And you walk in, as long as you can smell the roses, you're probably doing okay for now. It's not a bad message. Thanks, everybody.